Hello friends, my name is Sudarshan Dhushetty. My topic is diabetes mellitus. So, introduction. Diabetes mellitus is a group of metabolic disease in which there are high blood sugar level over a prolonged period. Symptoms of high blood sugar include frequent urination, increased thirst, increased hunger. If left untreated, diabetes can cause many complications. It includes ketoacidosis, non-ketoic, hyperosmolar coma, or death. Serious long-term complications includes heart disease, stroke, chronic kidney failure, foot ulcers, and damage to the eyes. Diabetes is due to either the pancreas not producing enough insulin or the cells of body not responding properly to the insulin produced. There are three main types of diabetes mellitus: type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes. Next, type 1 diabetes mellitus. It results from the pancreas failure to produce enough insulin. This form was previously referred to as insulin dependent diabetes mellitus or juvenile diabetes. The cause for this type of diabetes is unknown. Type 2 diabetes mellitus. It begins with insulin resistance, a condition in which cells fail to respond insulin properly. This form was previously referred to as non-insulin dependent diabetes mellitus or adult onset diabetes. The primary cause for this type of diabetes is excessive body weight or not enough exercise. Third form is gestational diabetes. It is the main third form occurs in pregnant women without a previous history of diabetes. Next, comparison of type 1 and type 2 diabetes. So first picture, there is a sudden onset occur in type 1 diabetes and gradual onset occur in type 2 diabetes. Mostly in children, type 1 diabetes occurs, and mostly in adults, type 2 diabetes occurs. Body size for type 1 diabetes is thin or normal, whereas body size for type 2 diabetes is obese. Ketoacidosis is common in type 1 diabetes and rare in type 2 diabetes. Autoantibodies mainly produced or present usually in type 1 diabetes and absent in type 2 diabetes. Endogenous insulin, it means insulin produced in pancreas, low or absent in type 1 diabetes, normal, decreased or increased in type 2 diabetes. Prevalence 10% in type 1 diabetes and 90% occur in type 2 diabetes. Sign and symptoms of diabetes. Some central symptoms include polydipsia, polyphagia, lethargy, and stupor. Systemic symptoms include weight loss. Respiratory symptoms include small breathing. It is due to hyperventilation. On eyes, it causes blurred vision. On breath, it causes smell of acetone. Gastric symptoms include nausea, vomiting, abdominal pain. Urinary symptoms include polyuria, glycosuria. Next, approaches to prevent diabetes. First approach is physical activity. Second approach is lifestyle changes. Third approach is mental stress handling. Fourth approach is uses of hypoglycemic drugs or insulin. Next, here the structure of insulin. Insulin is discovered by Banting and Best. Insulin is made from chain A and chain B. Chain A contains 21 amino acids, chain B contains 30 amino acids which are joined by disulfide bridges. It means whole insulin contains 51 amino acids. Insulin is a polypeptide produced by beta cells of islets of Langerhans of pancreas. It has profound influence on metabolism of carbohydrate, fats, and protein. It is considered as anabolic hormone. Regulation of insulin secretion. About 40 to 50 units secreted daily by human pancreas. Normal value of insulin is 20 to 30 microunit per ml. Metabolism. Effect of insulin on metabolism. First, carbohydrate metabolism. Insulin causes increased glucose uptake by cell. It increases glycolysis. It also decreases gluconeogenesis. Effect of insulin on lipid metabolism. It favors synthesis of triacylglycerol. It decreases lipolysis. It reduces ketogenesis. And fourth, it increases utilization of acetyl-CoA in Krebs cycle. On protein metabolism effect of insulin. It enhances protein synthesis because insulin is an anabolic hormone. Next, mechanism of action of insulin. Insulin bind and stimulate alpha subunit of insulin receptor present on target cell that stimulate tyrosine kinase activity on beta subunit, which results in activation of cascade of reaction which involves phosphorylation and dephosphorylation that stimulate or inhibit enzyme which produces response. For example, increase glucose uptake or decrease gluconeogenesis. Preparation of insulin. Insulin preparation are classified into 5 types: rapid acting insulin analog, second short acting insulin analog, third intermediate acting insulin analog, fourth long acting insulin analog, fifth insulin mixture. First, rapid acting insulin analog includes insulin lispro, insulin aspart, insulin glulicin. Short acting insulin analog it includes regular or plain insulin. Third, intermediate acting insulin analog it includes 2 types: isophene insulin and insulin zinc suspension. Other name for isophene insulin is NPH. NPH means neutral protamine hexadone. Second, insulin zinc suspension is also known as lente preparation. Fourth, long acting insulin analog it contains insulin glargine, insulin detemir, and third insulin degludec. Fifth, insulin mixture. Insulin mixture is a combination of 20 to 50% regular or rapid acting analog with 80 to 50% NPH analog or longer acting analog. Anti-diabetic drugs. First, sulfonylureas. It includes glibenclamide, glipazide, gliclazide, glimepiride. Second, bigonides. It includes metformin. Third, phenylalanine analog. It includes ripaglinide. Second, nateglinide. Fourth, thiazolidinediones. It includes rosiglitazone and second, pioglitazone. And fifth, insulin. It includes insulin lispro. It includes insulin aspart or rapid acting analog or regular insulin. Some questions on my topic. First question: glycogen synthesis takes place in liver by mostly insulin, glucagon, thyroid, or both A and B. So the answer is insulin. Insulin was discovered by first Banting or Best, second Robert Hickock, third Pasteur, or fourth Rudolf Greatman. So the answer is Banting and Best. Next, which of the following is or are the causes of diabetes? First, down regulation of insulin receptor. Second, lack of insulin release. Third, decrease the sensitivity of cells for insulin. Fourth, all of the above. So the answer is all of the above. Next, which of the following are analog of insulin? Insulin aspart, second insulin glargine, third insulin detemir, or fourth all of the above. So the answer is all of the above. Here my topic ends. Thank you.